Okay, very exciting. Again, you know, that whole focus on chef contribution in the schools is really something that we were able to see live and in person. We heard Gracie talk about, and as well as we all know, some of the national initiatives through Let's Move, with Chefs Move to Schools. It is with great privilege for me to introduce our next speaker. I actually, really, when I looked at her bio, I think it should be a page long, Dora. If you don't know Dora Rivas and the contributions that she's made to the schools, but just to let you know, since July 2006, under her leadership, she's the Executive Director, Food and Child Nutrition Services for Dallas Independent School District. Dallas ISD earned the designation of District of Excellence in Child Nutrition from the School Nutrition Association and renewed this designation in 2010. Her district was recognized by USDA Secretary and the Texas Department of Agriculture Commissioner for having achieved the Healthier U.S. School Challenge Award for 154 elementary schools. Unbelievable. Everyone, Dora Rivas.
Thank you, Lizzie. You know, after having heard Lindsay and all that youth and energy and Chef Salazar, I mean, you know, the only thing that I can say is that Lindsay trained in Dallas, so I taught her everything she knows. And so now you get to listen to the old person that's been around for a long time. Anyway, thank you very much for asking me to speak and share some of the things that we're doing at Dallas ISD. Dallas ISD is about 88% free and reduced, so we have very low socioeconomic students, and we serve about 130,000 students for lunch every day and about 40,000 breakfasts. We operate all of the programs that Paige talked about earlier, and we have a big staff. We are self-operated, and what that means is that we operate at Dallas ISD, and basically it's all self-sufficient. The school district does not pay food and child nutrition. We're self-supportive, so we have to operate like a business. And we do have a large staff to be able to operate all of the 250 schools. So we do have a business services director within the department. We have a technology director. And then we have Margaret Lopez, who is here also. She's a registered dietitian and had been the director at Laredo ISD, but she handles all of our nutrition, education, training, and quality assurance and compliance. And then Brad Trudeau is our procurement and production specialist, and he's an executive chef as well. Doesn't do all the fun stuff that you heard earlier. But I think one of the things that I would like to be able to share with you is that you know, after all of these years, and I've been a director for 36 years, I started out at Brownsville ISD. Some of you know me from there. And then just about, it's already close to 7 years I've been at Dallas ISD. One of the things that I've learned through the years is the importance of partnerships. And I think I really want to focus, as I talk about the nutrition initiatives, is how important those partnerships are. School partners, I think that we are very action-oriented as food service directors. And you tell us we have to serve meals, we go buy the food, we hire the staff, and we just know we got to get it done. And we tend to operate where we have control over. And I think one of the things that we've really learned through the years is that if we don't work with the principal and the teachers and the administrators and don't have support from the upper administration, that it just makes our jobs a lot harder. And so, and I think the sooner that we learn to just, embrace the partnership that we need to have with the school community, the much easier our job is. Our community partners, I think that, we're afraid sometimes that, we hear the criticism and how school meals are quoted sometimes in the media as making our children sick, that right away we put our guard up and we think, gosh, if we're going to go and talk to all these parents, the first thing they're going to do is, criticize. And, as you've heard Gracie earlier this morning, I think, what she was trying to do is reach out and tell us that, parents, community are out there to support, because we are all in it for the same thing, and that is to make our children healthier. And that's another partnership we really have to embrace. And we have a lot of support. Our government partners are there. And so basically, a lot of what I'm going to be talking about is how those partnerships work, and how really as a department, how we have to establish our priorities for nutrition education, working with nutrition education and physical activity, marketing and training, and then ended kind of with like an example of how we use those partnerships to be able to solve one of the problems that we were having in our district. I think, in Texas, as we heard Paige mention earlier, are very fortunate to have had. I think that at first we were, a little upset as food service directors, because we've always served what we feel were healthy meals. And having someone, from the Department of Agriculture telling us that they weren't as healthy as they could be, also challenged us. And so I think that through the years, as we have evolved in making our meals healthier, we're very appreciative of the fact that Texas is one of the leaders, because very early on we had the Texas Public School Policy. So when national, at the USDA level, they came out with requiring us to develop wellness policies, I think we were already way on our way to working with our communities and our school administrators on making some of those changes. And the wellness policy that was required of us required that we involve parents and community and a school board member to develop a wellness policy. As we were developing the local wellness policy, we really just rolled right in with the Texas Public School Policy that was already in process of implementation. And so part of that wellness policy includes that we assess our progress, and that we give the school board a report on our progress. And I think doing that process, checking along the way, has helped us continue to move forward and has made us accountable in being able to share with the board and the community how we are progressing. And I think one of the things that we also have not been in the comfort zone of tooting our horn, so to speak, because we've been doing a lot of these things. And I've been a director for 36 years. And 30 years ago in Brownsville, we were already doing whole wheat bread. I had already required that in our district. We already had moved toward low-fat milk. And I already very early on had the challenge, and I was kind of, remembering back when I had a student tell one of our cafeteria supervisors, but there's something wrong with this bread. It's old. It's brown. It's not good. And so, you know, it became an education process in letting them know that this is whole grain. That's why it's not white. And we went just, you know, straight across. All of our hamburger buns, our hot dog buns, our hamburger buns, all our bread, sliced bread was all whole wheat. And so the kids just kind of got used to it because that was what was being served in sandwiches and along with their meal. Well, you know, and I think a number of you said that sometimes it just takes time. And I think one of those examples when it finally just said, you know, I think we're making progress. And one of the things that we did during an open house is I had the cafeteria supervisors go and during the open house open up the cafeteria and show them what equipment we had, have the menu there available, talk about what we did. And one of the parents came up to one of our cafeteria supervisors and said, you know what, I'm having to buy whole wheat bread now because my child likes the bread that you serve in the cafeteria. And you know, I think, you know, I'll share one more story. That's something that we have had to make changes. And I heard Gracie talk about her kids and how she just taught them very early. And I grew up on white bread. And so when I had kids, I thought, okay, you know, I think I need to make sure my kids eat whole wheat bread, and was going to switch over. And my kids were a little older, and they said, but Mom, we don't want to eat. They were old enough to be able to tell me what they liked and what they didn't like. And I said, okay, I'm going to blindfold you. If you can tell me which bread it is and you tell me which one you like better, then I'll let you have that bread. Well, of course, they didn't realize that if they were blindfolded, they couldn't see what I was serving, right? But that wasn't the case. I was honest, and I did, you know, give them the true taste test and gave them the white bread and the three of them all picked the whole wheat bread. And they said, but it tastes better. And I said, yes, because it's whole grain. It tastes better. And so I think it's going to take time to get that message through. And I think it is very true that it's through the children that we're going to be able to get to the parents to make changes. Coordinated school health, I think in our district in Dallas has been a real success, and this is our structure. We basically have a leadership team at the executive director level, and this is the administrators that deal directly with the administration and the school board or the superintendent. And that means that any health initiative or nutrition initiative goes through that group. And because if you can imagine with 200 schools, we have all kinds of programs and people that are going to all the principals, and we'd have 1,000 different people trying to really take advantage of the principals with all these different programs that they would be offering to buy from them. And so what we do is we are the screening tool house for those programs. And, you know, we have the Alliance for a Healthier Generation. We did the Memorandum of Understanding with them. We have the CATCH program. And so at that level, we make the decision to do a district-wide effort on this. We then work with coordinated school health implementers. So we have representatives that are directors in all of those different levels or departments, health services, support services that includes the psychologists and the counselors and all of the physical educators. They go out and actually then work from the administration level to the schools at the campus level. So then they implement, you know, all of these programs. And then at each school, we have a campus leader. And so then they are the ones that at the campus work with the teachers and the cafeteria staff, and that's why CATCH is really very, very effective, because it does include training that incorporates all of the different areas and creates a partnership at the school. We have a school health advisory council, which is which you heard about, where half of the group or committee consists of parents, and then, as I mentioned, we also have the work with the Alliance for a Healthier Generation. We have all of these different community partners, and they have really helped us be able to implement initiatives that we're able to demonstrate, because for the Healthier U.S. schools, not only do you have to have a good menu that meets all of the requirements, but it incorporates having nutrition education at the campus level, as well as physical activity up to so many minutes per week to be able to meet those requirements. And so all of these different organizations, the Action for Healthy Kids, the American Heart Association, they were the ones that connected us with the Alliance for a Healthier Generation. Dairy Max has, in a number of our schools, doing Fuel Up to Play and doing breakfast grants. We work with the United Way, and they're helping to coordinate efforts, and our community has a coalition for reducing childhood obesity. We work with the Baylor School of Social Work, and they have a Texas Hunger Initiative to really end hunger. And then we work with internship programs, and bringing, and that's how Lindsay was involved at Dallas ISD, and I think one of the things that we really, in order to keep our department fresh and alive and innovative, is to be able to have the fresh ideas coming in from the interns, and different communities from across the state. There's some university, some student out there looking for that valuable experience to be able to take into the real world, and I think that we gain a lot more from the interns sometimes that I feel that they get, from us. Our government resources, of course, the Healthier U.S. School criteria, I think, has done a lot to be able to help us have a systematic way of improving our menus. Our menus prior to that were meeting the dietary requirements, as was mentioned earlier. But I think the Healthier U.S. School criteria, with offering more fresh fruits and vegetables and dark green and so many orange fresh fruits and vegetables, and incorporating more whole grain in the menus. And we were already, because we'd made a lot of changes, had to just do a little bit more tweaking to our recipes, and that's why we were able to move along more quickly in just putting the documentation together for the Healthier U.S. schools, and why so many of our schools are there. Working with the Department of Agriculture and the Bring It with their 3 E's, and then the National Food Service Management Institute, and I don't know how many of you are familiar with that, but they provide a lot of free resources for nutrition education, employee training, and it's free. It is funded by USDA to offer materials to school food service cafeterias or departments. And I think one of the things that especially small districts, we have to, whether you're small, mid-size, or large, you have to start out with a goal and a priority to make wellness up at a high level. We have chosen, and being that I have been a registered dietitian for many years, nutrition has always been high on my priorities. for the department. And so, and I've been very involved with the School Nutrition Association and the Texas School Nutrition Association, and they have Keys to Excellence programs. And whether you're a small school district or a large school district, having those standards, and one of those standards happens to be nutrition and nutrition education. And it kind of gives you a guide to be able to give your department a direction to be able to achieve some loftier goals. And so so we do strategic planning as a department, and so this way we're able to get everybody on board in the same, on the same page and direction in putting nutrition at a high priority in the department. Promotions, we do we have a nutrition education plan, which I'll talk a little bit more about later. This past year, we did a wellness luncheon, and having the school partners, the principals, the superintendents, the administrators at the campus level involved and knowing what you're doing is very important. So what we did is at the beginning of the year during their in-service, we tried to get on their agenda. Well, we all know their priority is to do better performance-wise. Their agenda was all full, and they could not allow us not even 10 minutes on their agenda to be able to do that. So we decided, well, what if we give you all a free lunch? And they said, well, yeah, we can do that. And so during that lunch, I said, what we're going to do is introduce you to all of the new items that we're going to have on our menu. And we're going to have like a little wellness fair, or when you go through the line, there's going to be all these tables. And so we had materials for them on school gardens. We had AgriLife come in and set up a booth. We had the Cooper Clinic set up a booth. We had the Heart Association. All our different community partners came in and offered free materials. Fuel Up to Play, Dairy Max was there. All of these different partners came in and offered all of these free resources and materials for our principals. And even if they just picked up the material, it became an awareness for them. So then when our staff would go to the schools, they were exposed, they got to taste the new food items, so therefore they encouraged the students at the school, and then they got to see what it was supposed to look like, and then they report to us if it doesn't look like it's supposed to look like or taste like. And so they know what the standard is and the expectation that we have, so that way they help us in that partnership of being able to provide quality meals to our students. Nutrition education, we have a monthly nutrition education and promotion plan. Doesn't have to be really sophisticated, but we just have on our calendar every month one promotion or the other. It may be at the beginning of the year just a welcome back and talk about, this year we went to food-based, so we had a kind of like the food plate that came out from USDA, the My Plate, and but we modeled it with the school lunch, like a school lunch plate, and told them what are the different components that they were going to be getting. Then maybe November, we're doing the SNA School Lunch Week promotion on Grow Healthy and promoting school gardens. And then Texas, the association has, they have breakfast and lunch weeks, so that might be a different month. And diabetes awareness, there's, I can't remember which month that is, but they have a month, and so we promote diabetes awareness. And then there's just different promotions that the Department of Agriculture, they brought out the initiative on Bring It, Texas Bring It, and so we incorporate that into our plan. And then we're involved with community activities. They have the Mayor's Passport to Health, they have health fairs, and then our district usually ties in with some initiative like that as well. So we try to just incorporate that as a regular, ongoing promotion. But I think one thing that I think food service directors know, and this is why sometimes nutrition is up on our priorities and on our mind all of the time, but in the end, we also operate a business, and we have to be aware of that bottom line, and that has been a real challenge, because good food that is healthier with more dark green vegetables and whole grains costs more. So this is something that, you know, we have to look at. And so when we set up our strategies and our goals, we have to keep all of these things in mind. And I think this is just an awareness that I want to bring, you know, to you today, is that we have, in our department, we set up our goals based on internal and external measures. And so we set up our goals this way. So internal measures is that this is how our administration measures us to know whether we're doing a good job or not. And a lot of urban districts, they have an organization, and it's called the Council of Great City Schools. And they have certain criteria, and they'll say your meal participation for breakfast should be at this level, and lunch should be at this level. And then they compare you with all of these other districts. And if you're on target, you're good. You're probably, you know, going to have your job next year if you're meeting those criteria. Financially solvent, you've got to be in the black. So you've got to be able to know what your labor costs are. And then your customer service, and it's like Beth mentioned in the district, when we see our participation going down, that worries us because we're measured by our participation. And then there's the external measures, and those are things that we're responsible for, but somebody from the outside of our department comes in to tell the district and the superintendent they're doing a good job or not. We can tell them, and we might, you know, be able to say, well, our customer will do our surveys and everything and let them know that our students are doing well. Those are things that we might have control over. These others, somebody else comes and measures it. The compliance, the Department of Agriculture comes in and does a CRE, coordinated review effort. So we are measured by that as to how someone else is assessing us. Then there's that community image, you know, and if the superintendent and the principals are getting calls from parents and they're not happy, then that's affecting our image. And so what has really helped our image, and I think it has really improved in our district, is always being able to say, well, we have 154 schools in our district that are healthier U.S. schools. We are a standard of excellence. We're involved in the community. All of those things and our involvement there help improve our image. And so I think if anything else, if you're finding it difficult to get into the nutrition education mode and the healthier menus, it really makes a difference as to how you're perceived in the community and how your district perceives you. And food safety. Health department from the outside comes in and measures whether you, and these are all key measures. And so one of the things is that under compliance, food and labor costs, we have targets. We have targets that, you know, I mean, really compliance is CRE comes in, you have a passing grade, and we're good to go for another 3 years. It used to be 5 years. Food and labor cost, we're on target with that. We're good to go. Well, in Dallas, one of the things, and this is the example that I'm giving you on the importance of having those partnerships. Our meal participation for lunch is above what other urban districts have. But we were having a challenge with our breakfast participation. We were at 34%, and for as high a percentage that we have on free and reduced of 88%, we were just short of meeting what the average is for our target. And so how can partners help? Well, we know what the benefits of breakfast are. And so it was definitely not just to meet the target, but to meet all of the benefits. We know that if, as a team member of the school district, we want to be able to help our students perform better in the classroom, that it was also in our best interest to see what we could do to reach out. And so we received a grant from the partners for breakfast, and it was a grant. We've also received a grant from Dairy Max for breakfast, and so we went from 0 breakfast in the classrooms to this year having 56 breakfasts in the classroom. And that is that in this year we're reaching about 17,000 students more a day than we were last year. And so I think that is a real accomplishment when we involve other people. These were schools that we piloted, and so you can see there from May 2010 to May 2011, the increases in participation at these schools went from about like 25, average 30, went up to 90% of the students participating for breakfast. So where we were only reaching 35% or 34%, working with our different partners, not only were we able to reach more students to where, you know, students are ready to learn in the morning, then, you know, we also were able to increase our revenues. And so the partners that helped us reach that goal that we were trying to accomplish was we worked with USDA, and they came out and talked to our superintendent about breakfast in the classroom and how that would help us reach our goals. The Texas Hunger Initiative, the Teachers Association, is helping us be able to serve as a liaison between the teachers and our department to meet with them and talk to them about the benefits of breakfast and why maybe expanding to breakfast in the classroom would be of benefit to them. Dairy Max is supporting us with some grants and with some resource materials. And then the North Texas Food Bank is, you know, also helping us with providing, they've adopted schools to be able to help because it is more labor intensive with some, they're helping us with some volunteers to come and help distribute breakfast. And so in the end, you know, I just want to be able to use that as an example of how having a strong nutrition program, you know, and with all of the responsibilities that food service directors have, that, you know, it's okay to ask for help and partners and in all of these different areas so that we can accomplish all of the things that we want to accomplish to meet the needs of our students and make them be healthier. Thank you.
We have a couple of minutes for some questions before we break. Yes, smoothie.
Right, and we have, you know, we started out several years ago with only a couple of gardens, and we're up to about like 40 different gardens in the district. And really, the food service department hasn't really gone out and really promoted them. I think, you know, the community has really embraced school gardens, and with Michelle Obama really promoting school gardens, I think a lot of those have really taken off. How we connect them, and we realize that whatever they're preparing is not going to be able to feed everybody. So what we're working on is to be able to tell the campus, if you are growing butternut squash or spinach, we either have it on the menu or we can buy it and put it on the menu, and then be able to then let the students taste a vegetable that they grew in the garden. So this way they're able to connect, you know, what they grew in the garden to what they can eat, you know, at home and prepare at home. And that's where I see the connection. Or nutrition education, that we can prepare whenever we place that item on the menu, that we can help provide the nutrition education. Now, we also have the fresh fruit and vegetable program, and I don't know if many districts here have that, but that has done a lot to help promote more students eating more fresh fruits and vegetables, because part of that program includes providing nutrition education. So when the teachers, what they do is they serve the samples of fresh fruits and vegetables that we offer, then along with it they talk about that fresh fruit and vegetable in the classroom. And the teacher also gets a free sample of fruit and vegetables, so they get to model that for the students. And this year we're going to see how that works, but we've started offering a higher number of vegetables than fruit. I think most kids will eat fruit, but we're really wanting to expose them to more fresh vegetables as well. So we'll see how that goes. But the program is to expose the students to the item, whether it's a school garden or a fresh fruit and vegetable. It's going to take time. And I think when Gracie mentioned, you know, sometimes we have to be patient. It's not all going to happen. I've been in it for 30 plus years, and progress is slow. And but I think we have to keep at it, and you know, just not give up.
One more question? Actually, it's not a comment. Could you tell us about, and I believe the cheer program that you implemented at Dallas ISD, about the color coding and teaching the students about various different...
Well, we do the Go Slow Whoa concept as well. And what we do is we printed it on the menu, and on the menu itself, you know, we color code or put a little symbol on there to help the parents be able to help the students make the choices when they go to the cafeteria. Now, we also experienced a small drop of participation, and that just and I don't know whether it's the menu that's the only big change that we have, or whether because of the economy some of the paying students are not participating. We have to do a whole lot more study on that, but I think we're having to really expose, you know, the students to some of the new foods. And as we took pizza off, as we used to have it on every week almost, or every other week, we might only have it once every 2 weeks now. And so, well, and you know, but at the same time we worry, well, did we do the right thing? Because now instead of them coming into the cafeteria, they're not being exposed to the fresh fruits and vegetables or the milk or the other items. So we still, and there's nothing wrong with the pizza because it's whole grain, it has the skim milk, it has all of the nutrition. But what we were wanting to do is to do more education and expose them to other foods. So I think us as food service directors, if you can imagine a juggler, and we've got all these plates, you know, and nutrition, bottom line, participation, all of those metrics that we talked about, it's a tough job. And so I think as community people, as parents, really approach the food service directors in a positive way and not a critical way, because we really have tough jobs. And I think they need support to really reach the parents and to encourage them to get the students to come into the cafeteria, because the more students that participate, the more we're able to do the things that really will help improve their health. The school meal is the healthiest meal that they will probably get anywhere, because it has all of the components there for a balanced meal. And so I think, I can't emphasize how important that partnership is for us.
Thank you again, Dora, for all of your work and for your insights. And we can see, again, I think understanding how a school district operates and all the compliance requirements, internal, external, dealing with, the factors of the home. Some homes usually we find in affluent areas, yeah, they might have an extraordinary lunch that I would pay $15.95 for. But, that's not the case what we see in the majority of the children who bring lunches from home. Yeah, absolutely.
And I know I'm the one that's keeping you from the cafeteria lunch, but I do want to make one other comment, and then, because I think that we try things, and if they work, then we continue to work. And we tried hummus, and I just want to share that with Lindsay. We tried hummus, and it wasn't really going. So your idea, about maybe we should call it something different. What we did is we said, our kids are over 70% Hispanic students. And beans, pinto beans is a good source of protein. So maybe we should be doing bean dip. And so we went from hummus to bean dip. And, it's all in change. It's funny because, okay, so now the kids, they like the bean dip, and then we get a call from a principal, and he says, "What are you doing serving bean dip to our students?" So I had to explain to the superintendent, I had to explain to I said, this is a good protein, and it's a vegetarian option. So, it's an education thing. And, but, we had to kind of sometimes take a step back and do something what students are familiar with in order to move forward. And so, it's having that flexibility and give and take is really important.
Absolutely. Very well said, and we'll end it on that note. Very well stated.